Deficiency disease, malnutrition. Before entering into malnutrition, first we should know what is meant by nutrition. Nutrition is a full of nutrients in the form of carbohydrates, proteins, and amino acids. Our body is in need of all these nutrients for growth and development of the body. If we don't take these nutrients into our body, especially in children, they will face malnutrition. Malnutrition is food that contains low number of nutrients, not even more than one. Reasons for malnutrition. 1. Lack of awareness and importance of nutrients. 2. Intake of low food. 3. Poverty. 4. Persons having poor health by having low immunity power. Persons having lack of strength to fight against dangerous diseases like diarrhea and roundworm infections. 5. Sanitation. Malnutrition effects are based on 1. Age. 2. Health. 3. Duration of time. Based on duration of time, malnutrition effects are of two types. A. Short-term effects of malnutrition. B. Long-term effects of malnutrition. Short-term effects of malnutrition. Here, body does not face more complications when compared to long-term effects because by following reasons. 1. They use stored food, that is, carbohydrates, fats, and proteins to generate energy. 2. Low amount of nutrients are exerted from the body. Long-term effects of malnutrition. It will differ between adults and children. In adults, 1. They will become weak and tired. 2. Unable to do heavy works. 3. Easily affected by infection caused by bacteria and viruses. Safety measures. Intake of adequate and sufficient nutritional food to meet energy loss from the body. In children, children have to face more severe problems because their body will use reserved food very quickly. In children, malnutrition is classified into three types. They are 1. Children having insufficient amount of energy-providing nutrients such as carbohydrates and fats, called calorie malnutrition or energy malnutrition. 2. Children having insufficient amount of proteins, called protein malnutrition. Example, Kwashiorkor. 3. Children having insufficient amounts of both proteins and energy providing, such as nutrients, carbohydrates, and fats, called protein calorie malnutrition. Example, Marasmus. Kwashiorkor. This disease is mostly seen in African countries as they do not have much awareness about nutritional food. Kwashiorkor is an African word. It means displaced children. It is a type of malnutrition disease having low amount of proteins and high amount of carbohydrates. Symptoms of Kwashiorkor disease. 1. Underweight, which means very lean. 2. Large belly due to enlargement of liver, storage of water at intercellular spaces in the liver. 3. Change in color of hair. 4. Poor muscle development. 5. Frequently suffering from diarrhea. 6. Swelling of muscles. 7. Growth will reduce. 8. Loss of interest in playing. Marasmus. It is also a type of malnutrition due to insufficient amount of both proteins and calories. Symptoms. Face will look like that of an old man. 2. They are very lean and weak. 3. There is no fat under the skin and become dry. 4. There is no swelling of legs. 5. They are also underweight. 6. Repeated childbirth. There is no particular time gap between first and second baby. Measures to stop this malnutrition in children. 1. Should maintain time gap between childbirths. 2. Should improve awareness on nutrients. 3. Healthy food should be given to growing child. 4. Avoid giving other sources of milk. 5. Stress the importance of mother's milk to her child. Mother should give her milk to her child as it is the only step which leads to the development of a healthy baby. Obesity. It is not restricted to, like adults and children. It is irrespective of all ages of persons, like children, adults, and old people. Nowadays, obesity is a health hazard and a dangerous disease. Sometimes it is hereditary. Body needs nutrients in specific amounts. When 20% of the body weight is filled by fat molecules, then that person is said to be an obese person. Due to overeating, excess energy gets converted to fat molecules. This excess fat is stored in adipose tissue of liver. As number of adipose tissues increase, simultaneously body size starts increasing slowly. Factors of obesity. Intake of more oily foods. 2. Storage of more fat molecules. 3. Loss of exercises. 4. Lifestyle. 5. Intake of junk foods. Problems due to obesity. It leads to various diseases like 1. Heart diseases. 2. Tiredness. 3. Diabetes. 4. They cannot walk for long periods of time. 5. Laziness. Preventive measures. 1. Intake of sufficient nutrient food. 2. Do regular exercises. 3. Avoid taking of junk foods. 4. Go for regular health checkup to control fat. 5. Spend more time on walking. 6. Avoid going by vehicles for nearby work like getting milk, vegetables, etc. 7. Should take fiber-rich foods.